Good morning, ladies and gentlemen. My name is Rafael Selman. I'm a medical doctor from Pontificia Universidad Católica in Chile. And today I'm going to present this work named Laparoscopic Pancreatoduodenectomy, Skill Development and Clinical Impact through Simulation Training. I have no relevant disclosures to say. And as an introduction, we can say that the laparoscopic approach for pancreatoduodenectomy offers clinically significant advantages compared to the open approach when performed by expert surgeons, and a reduction in postoperative complications and conversion to open surgery is after 25 or even 84 cases, mainly due to the reconstructive phase. There you can see in the upper part of the screen a pancreatoduodenostomy simulated, and downwards a coledoco-jejunal anastomosis, also in simulation training. And it's also important to say that training these skills in a simulated environment may help shorten this learning curve. So our objective is to describe a 7-year experience of a laparoscopic simulation course in HPB surgery and infer its clinical usefulness. We used a quasi-experimental design. The participants were trainees who completed this HPB course between 2017 and 2023. And this course encompassed 25 stages simulating a coledoco-jejunal and pancreatoduodenal anastomosis using synthetic and ex vivo tissues. And there in the screen, you can see the setup of the course. And it's also important to say that, for example, the Wirsung duct goes progressively decreasing as the common bile duct. For pre and post training assessments, we evaluate them using a global rating scale that went from 5 to 25 points, a specific rating scale from 4 to 20 points, procedural time and leakage rates. And to analyze this, we used non-parametric statistics. Also, we used an online survey to assess the impact of the course in the trainees regarding experience, exposure, and confidence in HPB and digestive surgery cases. The results were that we had 50 trainees who completed the program, and significant improvements were seen in the global rating scale and specific rating scale. For the coledoco-jejunal anastomosis, we went from 16 to 24 points for the global rating scale, and from 12 to 19 points in the specific rating scale. Also, in the pancreatoduodenostomy, we went from 17 to 24 points, and from 12 to 20 points in the specific rating scale. Also, a significant reduction in procedural time was seen for the coledoco-jejunal anastomosis. We went from 27 minutes to 18 minutes, and for pancreatoduodenostomy, we went from 36 minutes to 21 minutes. The leakage rate also decreased for both procedures. And for the survey, we can say that we had a 40% response rate. 80% declared a perception of improvement in their surgical skills. 85% stated that they had increased their confidence in laparoscopic hepatobiliary procedures. And 60% reported that they had increased their exposure to digestive and hepatobiliary laparoscopic procedures. As a conclusion of this study, we can say that this HPB surgery simulation program demonstrated its efficacy in enhancing surgical skills within a controlled environment. Survey responses emphasized its positive influence on participants' surgical capabilities and the importance of structured simulation-based training in hepatopancreatobiliary surgery. This was my presentation. Thank you for your attention.